Okay, guys, so for the second part, okay, so Entamoeba histolytica, guys, has two major forms. Okay, so do not copy this one yet because that is not the pathogenesis. So we have the invasive and the non-invasive form of Entamoeba histolytica. The one that produces amoebic dysentery or can cause a disease is the invasive Entamoeba histolytica. Why is it referred as invasive? Because it has the ability to lyse the tissues. Okay, so that is the parasitic form, the invasive one. So what renders it invasive? Take note, guys, there are three virulence factor of the invasive form of the Entamoeba histolytica. So I encoded already it here. So I encoded the three virulence factor of the invasive Entamoeba histolytica. Number one, that is the galgalnac, that should be N. The galgalnac lectin, the amoeba pores, and the cysteine proteinases. So we'll discuss this further later. Okay, but those are the three virulence factor that allows the Entamoeba histolytica to invade the tissues. Okay, so we proceed with the next slide. So the Entamoeba histolytica causes the amoebiasis, which is also known as the amoebic dysentery. So the amoebic dysentery, this is an infection caused by Entamoeba histolytica. Symptoms may include abdominal pain, diarrhea, or bloody diarrhea. Complications can include inflammation as well as ulceration of the colon with tissue death or perforation, and people affected may develop anemia. Okay, so they can develop anemia. So the non-invasive infection, this is caused by the commensal form of the Entamoeba histolytica, wherein there will be no invasion. Okay, so for the invasive form, that it can cause intestinal disease as well as extraintestinal disease if it causes an extraintestinal invasion. Okay, so extraintestinal invasion, so the organs that can be targeted for the extraintestinal invasion are the liver, lungs, and the brain. Liver, lungs, and brain. Okay, so I'll shift to the second scene. So we go to word type. Oh, wait. Okay, so we have here the life cycle of Entamoeba histolytica. Again, guys, the infective stage is the cyst stage. So cyst from the environment is ingested, and it will, what will it do? Will it insist or exist? It will exist. Magiging trophozoite siya. Okay? Excistation occurs in the small intestine wherein your cyst, take note, it has four nucleus. Okay? Therefore, after excistation, it can produce four trophozoites. Okay? So the trophozoites, these are motile. And then, since they are motile, they can move through. What organ do they use to move? Their pseudopods. Okay? And this, if this is the invasive form, it can invade. Okay? It can cause an invasion, causing ulceration and amoeboma formation that may result to extraintestinal infection or lesions or disease. Okay? Targeting the liver, the brain, and the lungs. So, as you can see here also, guys, that invasion of the large intestine can possibly lead to discharge in necrotic debris. Okay, so guys, going back to the amoebic colitis. Okay, so there will be, it can possibly have bloody diarrhea. Okay, guys, if the stool is bloody and it has a blood streak, or that it is red in color, the bleeding occurs in the large intestine. Okay? Pag visible yung blood sa stool mo, the bleeding occurs in the or occurred in the large intestine. Okay. However, if there is a bleeding and it is not seen or the color of the stool is still brown, okay, and if the fecal occult blood test positive, okay, if that is positive kasi it means there is a hemolysis. Okay, most likely, if the hemolysis is not visible in the stool because there are no blood, okay, visible blood in the stool, the source of the hemolysis or the source of the bleeding is in the small intestine. Okay, so here, if the incestation when dehydrated in bowel lumen. So this is already in the large intestine. If the environment, as I have mentioned, if the environment is watery, the stage will be in trophocyte stage. But if the environment is dry, it will insist. The trophocyte will become cyst stage to protect itself. So as you can see here, if the patient has a diarrhea and that is a watery stool, the stage that you can see on the stool is the trophozoite. In a semi-form, you can see trophozoite and cyst stage. But in a formed stool, what will happen? The trophozoite will insist. It will transform to become or to be in its cyst stage to protect itself from desiccation or drying. Okay, so the important note, again, Entamoeba dispar is morphologically similar with the Entamoeba histolytica. Okay, so take note also that the mature cyst or the resistant and infective stage of Entamoeba histolytica has four nucleus. Okay, the trophozoite has only one. The cyst stage has the chromatoidal bodies wherein their ends are. What is the morphology of the ends of the chromatoidal bodies of Entamoeba histolytica? Round blunt ends. Okay, so round blunt ends. So a patient is infected and he is a carrier. Okay, so he will pass the cyst in the environment wherein those cysts can infect other individual through this mode of transmission. So the viability is in moist and cold conditions that is up to 12 days, but in water it can survive from 9 to 30 days. Okay, so I hope guys that is clear. For example, ulitin natin, emphasizing the life cycle. If an individual ingested the cyst stage, which is the infective stage, that cyst will become trophozoite in the intestine. Okay, and that trophozoite can cause invasion, okay, on other sides of the body, different organs, and it can cause invasion of the intestinal lumen of the large intestine, leading to bleeding, okay, which may lead to bleeding. And that bleeding can be seen in the stool of the patient because of a bloody stool, okay, but not in all cases. Okay, so the diarrhea can, um, not all the diarrhea caused by amoebic colitis or amoebic dysentery will have a bloody stool or will result to bloody stool. And after that, the infected person can pass the trophozoite or the cyst stage in his stool. If that individual passes that cyst or trophozoite form in his stool, that stool, okay, or that feces can be the source of contamination of the environment, especially kung saan-saan lang naman tumataya yung infected individual, di ba? Okay, even if they are using proper sanitation, okay, or kahit maayos naman yung ano nila, they have sewage system. How about if the sewage system is not properly constructed? Okay, yung tae kung saan-saan napupunta sa ilog, okay, and that is contaminated with water. And if in case other individual are swimming or drinking water from that body of water, they can be infected also by the cyst stage of the Entamoeba histolytica. Okay, na galing sa infected na person. So I hope that is clear to you guys. Okay, so we go back to our PowerPoint presentation, scene 1. Okay, so I hope scene 1. Okay, so next slide. So I have this one on the next slide too. So we have here, okay, so the primary ulcer. So primary ulcer, early stages of the infection. And take note guys of this, flask-shaped ulcer are actually caused by Entamoeba histolytica. If you have case studies about parasitology and it was mentioned that the parasite caused flask-shaped ulcers in the intestine of the individual, most definitely that is caused by Entamoeba histolytica. Okay, Entamoeba histolytica. So, formation of sinuses as well and deep extension as well as invasion of other body parts by, as you can see here guys, so if the trophozoite stage invaded the intestinal lumen, okay, and it reaches the circulation, and it can travel through the circulation, then it can reach the extraintestinal site, the invasion of blood vessel, as well as the direct extension outside the bowel. Okay, so that is slide 31. So we have 60 plus slide. So slide 32. So Entamoeba histolytica. The detection of E. histolytica trophozoites with ingested red blood cell is diagnostic of amoebiasis or amoebic dysentery. Okay, so the standard method of identification is microscopic identification of trophozoite and cyst in stool. But guys, take note that E. histolytica and this spore are morphologically similar. Okay, take note of that. That's why in reporting, from the seminar uh, that I attended, the speaker mentioned that if you see only cyst in the stool sample, okay, so you cannot report it as Entamoeba histolytica. You should report that as cyst of Entamoeba histolytica slash Entamoeba dispar. Okay, so you would place that in the result form because you cannot make a definitive diagnosis when you only saw the cyst stage. Okay, so diagnosis of intestinal amoebiasis rests on finding either trophozoites in diarrheal stools or cyst-informed stools. Diarrheal stools should be examined within 1 hour of collection to see the amoeboid motility of the trophozoite. And what is the motility of Entamoeba histolytica, guys? That is progressive. Okay, that is directional. So the trophozoite characteristically contains ingested red blood cell. So we have here methods for the diagnosis. Direct fecal smear is the most common method for identifying parasitic infection, especially if that is intestinal. And the most common sample used is the stool sample. Okay, so you can use also other stains like iodine to enhance the different structures that is present in the stage of the parasite. Okay, to make it more visible, the different structure. Okay, to make the different structure more visible. Okay, number 2, the FACT and the MIFC. These are concentration technique and these are sensitive for detection of cyst. Number 3, stool culture. This is not common in parasitology. Okay, this is not common specifically done to identify the presence of bacteria, unless that is bacterial infection. Okay, if they suspect what bacteria, guys? Okay, we have the Salmonella and Shigella species. Okay, so this is for bacteria causing diarrhea. Okay, so serology. The serology is the method of choice for amoebic liver abscess, wherein detection of antibodies in the serum is still the diagnostic for this disease. Okay, next slide. Treatment. So there are two main objectives for the treatment of Entamoeba histolytica. First, that is to cure the invasive disease. And second, that is to eliminate the passage of cysts from the intestinal lumen. Okay, so those are the two main objectives of the treatment. Okay, so what is the consequence of B? Okay, so take note that elimination of the passage of cysts of intestinal lumen is very important so that uh, the passage of parasite in the stool is avoided so that the person will not act as the source of infection to other individual. Okay, so treatment, possible drugs for the treatment of Entamoeba histolytica, the metronidazole, which is the drug of choice for invasive amoebiasis, tinidazole and metronidazole for amoebic colitis, diloxanide for weight, and metronidazole, that is for the drug of choice for asymptomatic cyst passer, and tinidazole for the amoebic liver abscess. Okay, so what is the cardinal sign for amoebic liver abscess? That is 5, 4, 3, 2, 1. That is right upper quadrant pain. Okay, so right upper quadrant pain. So that is the cardinal sign for amoebic liver abscess. Okay, we proceed to the next slide. So, feeling ko malapit na tayo, guys. Okay, commensal amoeba. So, why do we need to discuss commensal amoeba when in fact they do not cause a disease or infection? They are not medically important, right? But why do we need to discuss them? Okay, so we need to discuss this bacteria or this parasite for us to identify, to know their characteristic, and to be able to differentiate commensal amoeba from Entamoeba histolytica. Okay, so we have to know their characteristic because this can be mistaken for the pathogenic Entamoeba histolytica. So we have Entamoeba, Endolimax, and the Iodamoeba. So Entamoeba, spherical nucleus with distinct nuclear membrane. So you don't need to include this in your output, in your outline, because we will go in details with these different species of Entamoeba, Endolimax, and the Iodamoeba. Okay? Okay, so we have the Entamoeba dispar. Again, the Entamoeba dispar is morphologically similar to Histolytica. That's why the characteristic, okay, of the Histolytica that we discussed, like chromatoidal bodies that has blunt ends, okay, so central caryosome, those are also the characteristic of Entamoeba dispar, as well as Hartmannite, but Hartmannite is smaller in size. The Entamoeba pelechi is the parasite of pigs and monkeys, and the cyst that is uninucleated, the caryosome, is very prominent. For gingivalis that is found in the mouth, gums, and teeth surface. It moves quickly and numerous blunt pseudopodia are present. Food vacuoles contain cellular debris and bacteria are numerous. And guys, the entamoeba gingivalis has no cyst stage. Again, we correlate it with our discussion. Bakit kaya walang cyst stage si entamoeba gingivalis? Okay, kasi nasa oral cavity siya. And if that is present in the mouth or it lives in the mouth, why is it that it does not exist? Okay? Bakit hindi siya nagta-transform into cyst stage? Because the mouth is watery. Okay? It is full of water. Therefore, it will not insist because it will not it is what do you call this one? It is a watery environment. Okay? It does not pose threat to the it does not pose dehydration to the trophozoite of Entamoeba gingivalis. Okay, Entamoeba coli. So guys, please memorize again the characteristics of the Entamoeba coli. So guys, this is a harmless inhabitant of the colon. Therefore, this is a commensal parasite. Morphology, the motility is sluggish. What do you mean by sluggish? That is slow moving or inactive. Okay, mabagal siya. Okay, slow moving, non-progressive, which means it does not move in a straight direction. Okay, it does not move in straight direction and it has blunt pseudopods. The nucleus of the trophozoite, just like with Entamoeba histolytica, it has only one. Pareho silang mag-isa ang nucleus. The peripheral chromatin, take note of this guys, in Entamoeba histolytica, it has fine granules, diba? But this one, it has coarse granules and irregular in size and distribution. The cariosomal chromatin in Entamoeba histolytica that is usually found on the center, kaya central. It has a central caryosome that is for Entamoeba histolytica. But for Entamoeba coli, that is usually eccentric. What do you mean by eccentric? Nasa gilid, wala siya sa gitna. Okay? Coarse, often vacuolated cytoplasm. So, as you can see here, guys, the Entamoeba coli vacuoles. So these are vacuoles. So inclusions, possible inclusions for Entamoeba histolytica trophozoite, bacteria, yeast, or other materials, but definitely it won't ingest red blood cell because this is a commensal parasite. Okay, so wait, we proceed with the next slide. Entamoeba coli, morphology of the cyst. Take note of this one. The nucleus, it has 8. Okay? So 8 in mature cyst. Therefore, it can have 2 to 8 number of nucleus in its cyst form. Unlike for Entamoeba histolytica, the mature form has only 4, maximum of 4. It can only have 4 nucleus. Okay, Entamoeba coli, it can have as much as 8 nucleus that is in the mature cyst. Okay, so peripheral chromatin, coarse, unlike for Entamoeba histolytica, fine. Okay, cariosomal chromatin, okay, eccentric, unlike for Entamoeba histolytica, that is central caryosome. For Entamoeba coli, eccentric caryosome. The chromatoid bodies or the chromatoidal bodies for Entamoeba histolytica are, what is the morphology for the chromatoidal bodies of Entamoeba histolytica? Round, blunt ends. But for Entamoeba coli, that is splinter-like with pointed ends. Mas matulis siya kaysa sa dulo ng chromatoidal bodies ng Entamoeba histolytica. So, glycogen usually diffuse but occasionally well-defined mass in immature cysts. Okay, it stains reddish-brown with iodine. Okay, so we have here, okay, the morphology or images of the Entamoeba histolytica and the Entamoeba coli. The Entamoeba coli, they are larger. Okay, so we have five, guys. Okay, we have widely 5 points of differentiation. First differentiation, so we differentiate them based on size. So the coli is larger than the histolytica. Okay, for the mature cyst, second differentiation, mature cyst of Entamoeba coli has a maximum of four, eight, eight nuclei. Okay, eight nuclei. But for Entamoeba histolytica, it can only have four. Okay, eight for coli, four for the cyst stage of Entamoeba histolytica. The Entamoeba coli has more granular. It has more granules in its cytoplasm, both the trophozoite and the cyst stage. Okay, so less granular si Entamoeba histolytica. Fourth, okay, fourth, that is splinter-like. The chromatoidal bodies for Entamoeba coli has splinter-like ends. Okay, so splinter-like pointed ends for the chromatoidal bodies of Entamoeba histolytica. Round, okay, round blunt ends for the chromatoidal body of the Entamoeba histolytica. Entamoeba coli, parang ang sinabi ko kanina is histolytica, no? Okay, again, splintered, pointed ends, chromatoidal body, Entamoeba coli. Okay, Entamoeba histolytica, blunt, rounded ends of chromatoidal bodies. Okay, next slide. So we have the Entamoeba hartmanni. So they are morphologically the same but smaller. Okay, so motility. The motility, guys, unlike for Entamoeba histolytica, for hartmanni, that is non-progressive. Therefore, it is non-directional. It does not move in straight line. Okay, so nucleus, the same with histolytica 1 for the trophozoite. The peripheral chromatin, fine granules, just like the Entamoeba histolytica. Okay, however, for the caryosomal chromatin, that is small, okay, and often eccentric. So, hindi siya, okay, so small, discrete, okay, that should be central, okay, that should be central, it's not eccentric. Why? Because, as the book says, it is morphologically similar. So, this should be often central, but sometimes eccentric. It has fine granular cytoplasm, just like the Entamoeba histolytica. Okay, the cyst of the Entamoeba hartmanni, just like with Entamoeba histolytica, apat din. Okay, so maximum of 4. Okay, peripheral chromatin is fine. Caryosomal small. See, that should be usually central. Okay, not eccentric. The chromatoidal bodies, so same, they have bluntly rounded ends. Pareho ni Entamoeba histolytica. Okay, the glycogen usually diffuse, concentrated mass often present, and stains reddish brown with iodine. Okay, Endolimax nina. Pause muna. Okay guys, so nag-water break lang po. Okay, we'll continue. Endolimax nina, morphology of the trophozoite, sluggish. What do you mean by sluggish again? That is slow moving. Okay, so Endolimax nina, that is slow moving and non-progressive. Okay, it does not move in straight line at mabagal pa. Okay, with blunt pseudopods. Nucleus 1 for trophozoite. So guys, as you have noticed, in the trophozoite stage, you only have one nucleus, regardless of the species, either or even genus, either that is Endolimax, Iodamoeba, or Entamoeba. For the trophozoite stage, they only have one nucleus. It does not have a peripheral chromatin. Okay? So, wala siyang peripheral chromatin. So, as you can see here, it's very clear. Yan yung nuclear membrane. Okay, it does not have the the peripheral chromatin. But take note of the cariosomal chromatin. It's large, okay, and blood-like. So it is irregularly shaped. Blood-like cariosome, that is large blood-like cariosome, that is Endolimax nina. Okay, so it has a granular and vacuolated cytoplasm just like for the trophozoite and amoeba coli. Pareho silang magkakaroon ng vacuolated cytoplasm. Okay, so inclusions and Endolimaxina bacteria. So morphology of this is, so for immature, again, no peripheral chromatin for Endolimaxina. Okay, no peripheral chromatin for Endolimaxina. So large cariosomal chromatin, blood-like. Okay, so chromatide bodies are occasionally granules or small oval masses. So same glycogen usually diffuse and stains reddish brown with the iodine. Okay, so we have here the Endolimax nina. As you can see, it has large cariosome. But actually, guys, in the microscope, it's really difficult to see the different structures. Okay, ang hirap niyang i-identify. Okay, Iodamoeba buchli. Okay, Iodamoeba buchli. So, trophozoite, motility again, sluggish, mabagal, okay, slow-moving or even inactive, usually non-progressive, it's non-directional, it does not move in straight line. Nucleus, since that is trophozoite, isa lang. Okay, peripheral chromatin, none. So, same with Endolimaxina, they do not have peripheral chromatin. So, cariosomal chromatin, same with Endolimaxina, pero sila may malaking cariosomal chromatin, usually central, okay, but that is usually central and surrounded by refractile achromatic granules. Okay, so coarsely granular and vacuolated cytoplasm because of the presence of vacuole, just like Endolimaxina and Entamoeba coli. So inclusions, bacteria, yeast, or other materials. It's draining, right? Sobrang dami. Okay, so we have here the Iodamoeba buchli. So this is the trophozoite stage and this is the cyst stage. And there is a glycogen vacuole here. This one. Okay, the diagnosis for commensal parasite. Okay, malapit na tayo guys. Diagnosis for commensal parasite. Same, there fecal smear because this is the most commonly method for determining intestinal parasite. Concentration technique, formalin ether concentration technique, and the iodine stain. The swab between gums, that is for Entamoeba gingivalis. And why is it that for commensal parasite, there is no treatment? Okay? Bakit walang treatment for commensal parasite? It's because they do not cause any disease. That's why you don't need to treat them. Okay? So, no treatment is needed for commensal parasite because they do not cause any disease. Okay? So, we're on slide 49. Malapit na tayo matapos. So, we have free-living pathogenic amoeba or amoeba. What do you mean by free-living, guys? Free-living. Okay, they can live on their own. They don't need other hosts like human or animal. They don't need hosts to live. Okay, kaya nilang mabuhay ng sila lang. Kayo, kaya niyo mabuhay ng kayo lang? Okay? So, are you a free living or a parasite? Okay, so we have the acanthamiba. Under free living pathogenic amoeba, we will discuss two genus of parasite. We have the acanthamiba and the Naegleria. Okay, so we start with amoeba. So they reproduce by binary fission, just like uh, what do you call this one? Entamoebas. But I think for this is the entamoeba. Wait, I'll just look at it. Okay. Wait, I'm a bit doubtful because I think I read that it was through mitosis. Oh, see? Guys, so the method for reproduction of the Acanthamoeba species is through mitosis. Okay, so please correct this one. It should be mitosis. Okay, they reproduce through the process of